KSMQ Health Connections, local healthcare providers answering your medical questions. This week's topic, nothing sweet about diabetes.
Good evening and welcome to KSMQ Health Connections, where we connect you with some of the finest minds in the medical field. I'm Eric Olson. Thank you very much for tuning in on this Tuesday evening. This fall, we've tackled a number of big issues on Health Connections, but in sheer numbers, tonight's topic affects more of us than any other topic we have spoken about this season. That is diabetes. So we have some numbers for you. Here's the first big number. 23 million Americans have been diagnosed with either type 1 or type 2 diabetes. Another 7 million have diabetes, but they have not yet been diagnosed. So that means 30 million of us have diabetes, about 9% of the U.S. population. Now, for folks older than 65, the numbers are staggering, more so. 12 million seniors have diabetes, which means just about 1 out of every 4 seniors. And if you're still thinking, well, it doesn't really affect me, 84 million folks are pre-diabetic, in danger of getting it. And that means 1 out of every 4 Americans will likely be touched by diabetes at some point in their life. You add up all those numbers, and it means 1 out of 3 either diabetic or in danger of becoming diabetic. That means we might be getting a lot of telephone questions from you tonight. So jump in early, start calling with your questions about diabetes. The phone number is 888-255-0121, or email us at healthconnections@ksmq.org. Our guest tonight is Dr. Sumit Bhagra. He is the medical director of the Mayo Clinic Health System, Austin Albert Lee. Good evening, doctor.
Good evening.
Before we get to your questions, we want a quick explanation here. We've put a little video together of how diabetes works. Most of us might know it has something to do with blood sugar levels, but maybe we don't know a whole heck of a lot more than that. We found an interesting animation about the biology of diabetes on YouTube, but Laura Beasley from Riverland Community College's nursing program vets it, and she explains what it means.
Let's take a look at when food gets to your stomach. Food is made of 3 basic nutrients: carbohydrates, proteins, and fats. During digestion, carbohydrates are broken down into sugar, otherwise known as glucose. Here's a quick fact. Carbohydrates are found in foods such as bread, rice, pasta, potatoes, fruit, milk, and yogurt. Normally, sugar travels from the stomach through the bloodstream to your body's muscle and fat cells. However, sugar can't enter these cells without the help of the hormone insulin, which is produced by the pancreas. Insulin acts like a key, unlocking the doors to the muscle and fat cells and allowing the sugar to enter. The cells then use the sugar as fuel to provide energy for the body. When everything is working well, the sugar entering the bloodstream from the stomach exits the bloodstream once it reaches the muscle and fat cells. And so that is how the body is able to regulate the concentration of sugar in the bloodstream. But it's different for a person with diabetes. When sugar enters the bloodstream, one of 2 things happen. Either the pancreas doesn't produce enough insulin to match the sugar entering the bloodstream, or the body's cells do not respond to the insulin that the body is producing. In both cases, the result is the same. Cell doors remain closed, causing sugar to get backed up in the bloodstream. As a result, blood sugar levels rise. This creates several problems. Because sugars are not able to enter your body's cells, your body is not getting the fuel it needs. As a result, you may feel tired or fatigued. Your body may try to dilute the excess sugar in the bloodstream by pulling fluid out of your cells. This can leave you feeling dehydrated or thirsty. Most important, over time, high blood sugar levels can cause damage to some of the vital organs in your body.
Our thanks to Laura Beasley, who is Director of Nursing programs at Riverland Community College here in Austin for that explanation. She's actually, Laura is hiding in the shadows here in the studio. She's been very important to us as we've started our show here, one of several RNs who are taking phone calls and emails for Dr. Bhagra. Thank you again for joining us. So a lot of people know there's type 1 diabetes maybe and type 2, but maybe don't know the difference. Can you give us a brief explanation?
Sure. So diabetes mellitus, mellitus means sweet. It is the type of diabetes that has characterized by high sugar levels in the blood. It is a group of disorders, type 1 and type 2 being the most common two types of diabetes, characterized by high glucose levels. Type 1 can occur at any age, but generally affects children. And type 2, again, can occur at any age, but generally affects individuals 40 years and older. That's sort of the basic difference between the two types. Other types that people might have heard of are gestational diabetes that affects women who are pregnant, diabetes that occurs due to other hormonal problems. I would not go into the specific details of that, and diabetes that occurs, so those main types.
Sure.
Yeah.
And is there a hereditary, like runs in families? Is that a factor?
I think that is one of the strong risk factors for type 2 diabetes and to some extent type 1 diabetes as well. If we find a type 1 diabetic patient, you are likely to find individuals in the family that have other autoimmune conditions such as thyroid problems or adrenal problems, or some type 1 diabetic individuals as well.
Certainly happened in our family with type 2, with my family and then me at about age 45. But there's lots of good treatment, at least it's been successful so far in the past few years. Is there any new breaking information, breakthroughs, if you will, about diabetes that we are about to learn about?
Sure. So we always look at magic bullet solutions for fixing problems.
Sorry, yeah, I know.
Unfortunately, there is no magic bullet for diabetes. It's pretty much old-fashioned stuff, which is eating healthy foods, being very active, and losing excess body weight in case people carry extra body weight on their self.
Right, plus I felt so lousy. That's a motivator too, because I dropped some weight a little bit and the medication really helped me feel better.
Sure. So again, lifestyle changes for type 2 diabetes form the foundation for managing it. Medications obviously help. Insulin is often used as a last resort. Some people use it early on as well. And there's probably half a dozen different classes of medications that have become available in the last, I'd say, 10 years or so. The list has expanded, and I'm sure we all hear brand names advertised during our favorite sporting events on TV. So.
Right, first to eat food, and then the next commercial will be have a good, healthy lifestyle. Yeah, exactly. That's how that works. Not on public television, though. We don't do it that way. Okay, as I mentioned, we have some RNs taking your calls and emails, and the phone is ringing. Call up. Whatever your question is about diabetes. Our nurse volunteer tonight, Nathan Hauber, works at Prairie River Home Care, a proud graduate of the nursing program at Riverland Community College in Austin. Nathan, you have our first question.
I do. Actually, I have two, so I'm going to throw two at you. The first one is from Jen in Austin, who asks, if someone has type 1 diabetes, can they get type 2? And the second question has to do with feet. Someone called in, they have diabetes, and they've been told to wash their feet, and they wonder why that is.
All right, so first, type 1, does it lead to type 2?
So, very interesting question. I think type 1 is defined as deficiency of insulin. And if a person truly has type 1 diabetes, they have type 1 diabetes for life. Where it becomes confusing is that generally, we think of type 1 diabetic patients as being young and not overweight, but obesity itself is becoming so common that some type 1 diabetic patients will gain weight because of genetic factors as they grow older, which then requires larger amounts of insulin. Some doctors call that type 1.5 diabetes, meaning they show features of type 2, such as weight gain and requiring large amounts of insulin, but essentially they have type 1 diabetes as the background reason for why they have diabetes.
Okay, so it's a rather moot point.
Lifestyle meets type 1 diabetes, and some of the features of type 2 mixed in with one, but it's not like they became type 2. It is that they got affected by environmental factors where they gained weight and had type 1 diabetes in the background. So,
and folks with diabetes and their extremities, feet, hands, blood circulation. In this case, the caller wanted to know about why do I have to be so careful with my feet and washing my feet?
Sure. So multiple reasons for why feet get affected. Nerves are affected by diabetes. The risk of developing nerve complications is to do with how severe the diabetes is and the duration of diabetes. Interestingly, the nerves that are most distant from the body tend to get affected more often because of lack of blood flow, etc. And therefore, feet are affected much before hands are affected, hands being shorter than lower extremities. So as the nerve supply dwindles, people will not feel, say, temperature or sharp objects touching on their feet. And then as the blood flow becomes less and less, any ulcer or sore sustained on the feet is likely to not heal well. I have seen many patients who may have a coin or a key inside their shoe, and they step in, they're not able to sense it. They might walk half a day in that shoe that contains an object that's rubbing upon their feet, leading to an ulcer, but they have no symptoms from it. And therefore, I think it is very important to watch your feet every day, wash them carefully, and more importantly, dry them. Make sure there's no moisture or maceration on the skin affecting your feet.
Because, and then, as I understand, it could take a lot longer for a cut or something to heal on your feet.
Absolutely. It may take 2 or 3 times the amount that it takes for normal non-diabetic patients to heal any kind of ulcer.
Okay, our phone number, 888-255-0121. Phone lines are open just in time for Thanksgiving. We're talking about diabetes for you tonight, but it's a serious, very serious topic. And we talked about, in the intro, pre-diabetes. And with all the information, it seems like there's still a lot of people who don't know that they may have it or have it. Is that they just don't want to think about it, or why is that?
I think it's many factors. Pre-diabetes typically affects men and women in their 30s, 40s, and 50s. Those are the prime years of a person's life where you're managing jobs, kids, and you're just busy. I think medical care at that point seems to take a back seat. Testing is available. The Preventive Task Force guidelines recommend that people be tested at age 40, perhaps sooner if they have a family member or other risk factors. I think many people don't follow through on those recommendations. If the numbers are slightly high, I think many people don't know what to do. There are many resources available, such as local gyms that might offer a diabetes prevention program. So you're right, it affects a lot of people. That stuff is not top of mind for 40, 50-year-old people who are managing and juggling various things in life, and we can do better. Boy,
that's really a good, you're raising your kids, that's prime time, and you're busy. So, Dr. Bhagra, thank you very much. Stay with us. If you've just joined us, this is KSMQ Health Connections. We're talking about diabetes with experts from the Mayo Clinic Health System. Are you or someone you may love struggling with treating diabetes? Maybe you're one of the 84 million Americans who are pre-diabetic. We've been talking about that. You're worried that you could be facing a lifetime of insulin shots, health complications. Ask your questions, ask away. Our phone number and email address are on the bottom of the screen. Give us a call, send in your questions. Welcome back to our show, and Nathan Halber has a question from a viewer. Go ahead, Nathan.
Again, I have 2 questions for you. Bob from Brownsdale called in asking how it is that diabetes can affect his vision. And then someone also emailed us a question asking if there's a way to prevent type 1 diabetes.
Which one do you want to take first? How about type 1?
Sure.
Can you avoid it?
So type 1 diabetes and preventing it. Great question, and I think there are many studies that have been done to see if anything prevents type 1 diabetes. There is no conclusive evidence that any intervention is able to prevent type 1 diabetes. There is a large national trial called the TrialNet Collaborative. University of Minnesota is one of the sites where if a family member who has type 1 diabetes is concerned about the risk of their children developing type 1 diabetes, they can look it up on the internet, find that phone number, and get in touch with researchers. They do have various interventions that are being tried out from time to time available to young kids to test for the risk of diabetes as well as prevent diabetes. But nothing conclusively has shown that preventing type 1 diabetes is possible. There are some studies showing that introduction of cow milk late or early in life, but nothing has been conclusively proven so far.
And then what was our first question of the two? Nathan, what was the first question from the two?
The first question was about vision. How does diabetes affect vision?
Vision, retinal.
So multiple ways in which high sugars can affect the vision, starting from the front of the eye going all the way to the back. So corneal swelling from very high numbers can result in visual blurring, as can cataracts for swelling of the lens. But I think the most dreaded and sometimes irreversible complication is diabetic retinopathy, which results in either swelling of the back of the eye, so the fine point in the back of the eye that focuses all the light. As it becomes slightly thicker, you lose the ability to focus light in a sharp sort of point-like manner, and everything becomes either blurred or crooked. You could develop bleeding in the back of the eye, which leaks into the clear part of the eye, resulting in loss of vision for many months and sometimes permanent damage as well.
And Nathan has another viewer on the line. Nathan.
I do. Bill from Albert Lee called in, and Bill had heard that cinnamon can help with type 2 diabetes. Is this true?
And you're smiling there, doctor.
Excellent question, because medical doctors are sometimes skeptical of the alternative therapies or nutritional supplements, but cinnamon is in fact one of those that has been studied systematically. There's been research published in traditional sort of allopathic medicine literature, which shows that cinnamon intake about 1,000 milligrams per day results in lowering of glucose levels, about a 0.5% A1C reduction, and some improvement in lipid profile as well. Mind you, cinnamon rolls don't count. It is the cinnamon supplement per se.
Oh, rats. Good answer. Good answer. And we talked about alternative therapies, but we were chatting, fascinating how diabetes was first, the story came about. It was not medical doctors or modern technology that first discovered this problem.
So anecdotally, we quote a very old philosopher, scientist from India, incidentally, who published that there are some people with a disease where the urine becomes really sweet and ants are attracted to that urine. He found that it was generally people who loaned money or money lenders in the village that got it. And if they were to take up farming for 6 months, it got better. So very profound observation.
Yes, and it wasn't the lending of money, but they were sedentary.
Correct.
That's the idea. And the farming, to go out and farm for 6 months, was the solution to get physical activity. They didn't maybe identify the correlation there, but that's really, really amazing. Thank you for that. Hey, we have 7 minutes to go about in our program tonight. Still time, great questions. Still time to give us a call, 888-255-0121, or you can email us as well, healthconnections@ksmq.org. And welcome back. We're continuing our discussion with Dr. Sumit Bhagra, Medical Director, Mayo Clinic Health System, Austin Albert Lee, talking about diabetes and some very interesting things we've learned already tonight. And there there's an age component with type 2 and seniors. Do they have more problems than younger folks?
So age is one of the risk factors for developing diabetes. Younger people are getting it nowadays. So if a person gets diabetes or diagnosed with diabetes at a very late stage in life, they are less likely to develop complications because they have a shorter period of time ahead of them. As we look at younger people in their 30s and 40s becoming diabetic today, they potentially have 60, 70 years ahead of them. In fact, paradoxically, the young people developing diabetes today are more likely to develop complications later on in life. The diabetic patients who are seniors, I think, face other challenges, such as, and these are not medical challenges, but really insurance coverage, high copays, meeting the donut hole, medications becoming really expensive. So we do have great solutions available in terms of expanding array of medical options, but the access of seniors to those treatments might be limited because of man-made business type factors.
Nathan, take it away. You have a question.
I do. I have a question. A caller called and asked if there are any new medications available for treating type 2 diabetes.
You touched on that just a little bit earlier, that there were a lot of them. You know, mine is Metformin, which I think is fairly common. Are there any other meds similar?
Sure. So not to mention any brand names, because that would be doing disservice to the unbiased, medical profession that I belong to. Generally, Metformin is the #1 medication used for treating diabetes type 2. There are many reasons to use it and some reasons not to use it. I'm not going to go into the exact reasons. Then I will probably touch upon the broad classes of medications available. One of them, called sulfonylureas, they act on the pancreas to permit the pancreas to perhaps secrete more insulin if there is capacity for the pancreas to secrete insulin. So that's one broad category. It was used very commonly in the past, and nowadays some new medications that help people lose weight in addition to lowering glucose are being used more often. One of them is called the Sglt2 inhibitor class, which acts on the kidney and essentially allows the kidney to leak extra glucose, lowering the glucose level, perhaps helping with body weight, blood pressure, and cutting the risk of heart attacks as well. So great new development. Another hormone called GLP-1, glucagon-like peptide 1, which promotes satiety, so people don't feel as hungry, they lose weight, and the sugars come down as well. Typically, these are injectable medications. So this is a great time for type 2 diabetes. The horizon is ever expanding in terms of what we can offer to our patients.
Basic information, too, on the Mayo Clinic website about your alternatives and how to see a specialist, make an appointment, that kind of thing.
Absolutely, yeah.
Nathan.
I have one more question. Janet from Albert Lee called, and she has a question. She has a friend who went through chemotherapy and developed diabetes, and she's wondering how that could be.
So there are many mechanisms for that. I think our cancer doctors sometimes use steroids, things like prednisone or dexamethasone. These are medications that make the body more likely to secrete or produce glucose. So without going into specifics, because I don't know exactly what situation the patient was in, they could have had diabetes prior that was undiagnosed, so that's one possibility. The other is some of the medications themselves were toxic to the body or allowed the body to make more glucose. So that can happen.
Probably not that often, but it does happen.
Yes.
So if somebody is feeling tired a lot, how many of these symptoms should they be experiencing before they think, I need to call in and see you or see one of your associates, colleagues?
So typically, early diabetes or pre-diabetes has no symptoms. It's a silent disease. So at the time somebody develops symptoms such as weight loss, being very thirsty, the glucose levels are probably very high already. So I'd say the people with symptoms already have waited too long and they need immediate care.
So any of them, if you're drinking a lot of water at night?
If you're drinking a lot of water, there's family history of you're feeling tired. It's a simple blood test. It's usually covered by insurance. There is no reason not to get that test to make sure you don't have diabetes.
Okay. One more from Nathan.
Yes. Tim from Clear Lake, Iowa called in. He's wondering, why do blood sugar readings seem to be higher in the morning?
Excellent question. And I'm looking back at the physiology books I read about 15 years ago.
Okay, we got about 45 seconds.
Sure. It's part of my medical school. So basically, long story short, there are hormones made around 4 a.m. in the morning by the body to prepare ourselves for the day. Some of these hormones improve alertness, and historically they might have been beneficial when people woke up at 4 and gathered food and went out to the jungle. Those hormones make your sugars go up in the morning, and that's the bottom line. Why the numbers are high in the morning.
Fascinating. Dr. Sumit Bhagra, thank you so much for coming in again this season on KSMQ Health Connections. Wonderful to hear what's going on in the world of diabetes. Well, that's all the time we have for tonight. Our thanks again to the Mayo Clinic Health System, all the folks there, and the registered nurses from Riverland Community College who handle the phone calls and the emails. Next week, we're going to talk about a related topic, nutrition and dieting. So right before the holiday, we talked about diabetes. Now we're going to talk about nutrition and dieting right afterwards. Holidays are here. A lot of us worried about putting on a few extra pounds. We'll talk not only about strategies for holiday eating, but also how to eat healthy year-round. Hope you can join us then.